Oh no. I've air blocked that now. Hello everybody, it's Charlie and welcome back to my channel, or welcome to my channel if you're new. Today I'm going to be doing a little demonstration slash, couldn't get that word out then, slash explanation video on teeth whitening. So I get a lot of messages from people saying, your teeth look really nice. I'm very, very grateful for my teeth. I was incredibly lucky. I never actually had braces. I got my teeth whitened and I'm incredibly happy with the result. So I'm just going to show you how I do that and then explain the process. So if you would like to see all of that, then just keep watching. So when you get your teeth whitened, and I have explained this in another video, you need to do it properly with the dentist. There's two different ways of doing it and it depends which one your dental practice does. Some of them will do both, but most of them generally only does the at-home one. So if you're doing the at-home whitening, what they will do is take some impressions of your teeth, and this is just done with alginate. It's in for maybe about 30 seconds until it's set. They take it out and they send it off to the lab. The lab will make trays specially designed for your teeth. So I'm going to show you mine. So I don't know how well you're going to be able to see this on camera, but these are my trays. I'm very sorry, you probably can't see very well. They are just very flexible plastic trays which fit perfectly to your teeth. Once you've got these little trays back, the dentist is then going to show you how to use them. So I'm going to explain that now. You will need to buy some bleach. Now, normally the dental practice will include this in the price, so you don't have to pay the price for getting these trays and then have to pay for the bleach on top of it. Did I just say play? Pay for the bleach on top of it. So they come in little tubes like this. Depends which company you buy them from as to how many you get. This one is half used, but they would, whoa, didn't mean to do that. They are going to be full right to the top. This is exciting. I like this little demo. I feel like one of those medical emergency people that come in and tell you about the different drugs. I'm not going to actually squeeze any out because I don't want to wait. Oh no. I've air blocked that now. Bugger. Oh no. Well, I've really buggered that up. I'm not going to squeeze it out because I don't want to waste the gel. But what you would do is you would just squeeze a very small amount into each of the teeth on your tray. So you're going to pop the little lid off, and they pretty much all look the same. So it comes, you're not even going to be able to see this, but it comes with like a tiny little cap. So you just take that off and you squeeze a little bit of the gel into each tooth. Just a tiny amount, because what you don't want to do is overload the tray and then when you put it in your mouth it's all going to ooze out. Pop it in the mouth and there you go. It's really hard to talk when they're both in. I'll show you. This is with both the trays in. It's really hard to talk. Obviously normally you would have gel in them, so it would be even harder. I've just popped them out because they're really hard to talk in and they're not very nice. But they are really, really easy to pop in and out because they're fitted exactly to your teeth, so you don't need to worry about anything. And once you've taken them out, I always brush my teeth afterwards just to get all of the rest of the gel off. When I first got my trays, I did it every day for 2 weeks, and then I went down to about once a week and then about once a month until I was happy with the shade. But generally after the first 2 weeks, they're going to be to a pretty good standard if you've done them every day. I will say that they can make your teeth quite sensitive. This is nothing to worry about, it's completely normal. I will then just brush my teeth either with normal toothpaste or with a sensitive toothpaste, depending on if I feel like my teeth are a bit sensitive after I've whitened them. They also come in a handy dandy plastic little case. The reason I'm showing it to you from the back is because on the front has the name of the lab, so I'm not going to show you the front just for like privacy reasons, but they do come in a little plastic case which obviously opens like that and you can put your two trays in. So just pop my trays back into the little plastic box now, close that up, and then I can put them back in the drawer ready for the next use. So I'm just going to give you guys a couple of tips now for teeth whitening. You can get your teeth whitened at any stage, but just be aware that the bleach will not whiten things like crowns or fillings. There can be some circumstances which actually stop you getting teeth whitening. I'm not going to go into all of them now, but it's not always the best for everybody. If you have very, very, very sensitive teeth, then maybe it's best to steer clear from it. There is something called the white diet, which you should stick to for about 24 hours after you've whitened your teeth. It is recommended to get the best results, and this is sticking to things like rice and chicken, nothing that's going to stain your teeth basically. So tea, coffee, red wine, No, just stick to water and juices that aren't too brightly coloured. Anything that can't stain your teeth. That's generally the recommendation, is that for the 24-hour period, you are eating and drinking things which aren't going to stain your teeth. I do brush twice a day, I floss every day. Occasionally I'll also go and see the hygienist just so that she can remove any staining that I do have, but I am very, very lucky with staining in that I don't get too much of it. Another huge advantage with doing it at home rather than in the dental chair is that if you do feel after 7, 8, 9 months that you want to top up a little bit, you can do that and you've already got the products at home ready to go. And I think that pretty much brings me to the end of this video today. I hope you guys enjoyed it. It was something that I actually got to demonstrate a little bit and tell you my personal experience, because it is something that I've had done. With a lot of my videos, like anything about fillings or things like that, I can't really comment on experience because, touch wood, I haven't actually ever had a filling. So it was nice that I actually got to give you guys my experience with it and actually demonstrate the real things. I've never been able to do that in a video where I actually show you the real stuff. Ow! I've got cramp. Sorry about that. So yeah, that was really good for me to do, and I hope you guys enjoyed that element of it as well. Please give this video a big thumbs up if you liked it. Don't forget to hit that subscribe button down below, and I will see you in my next video. Bye!